So before we conclude, as I mentioned, this is, I think the hope was that this would be a solutions-based sort of discussion. And so before we wrap up, I'd like to go down the line and just ask everyone to articulate one sort of takeaway, one sort of solutions-based takeaway that people can leave with today. I'll start with Mike, and we'll move down this way.
Yeah, and I think this links to that last question about the NRA. So I think for me, the takeaway is the way we can move forward in this conversation is to identify strategies that have a strong evidence base and that are very hard to disagree with. And I think community violence intervention programs squarely fall into that category, where there is incredible evidence that they can lead to a very large reduction in violence. And where we have gone to states to push for further investment, we have either not heard at all from the NRA, or the one time when we pushed for this in Maryland and the Republican governor of Maryland authorized a $5 million investment, you can imagine the optics of the NRA showing up and saying, we are opposed to an investment in communities of color to reduce gun violence. That was the position they were forced to take. So I think to the extent we can push the public health framework, it's very hard for the NRA to make a convincing argument that we shouldn't be taking those steps. So that would be my takeaway, is continue to push the public health model. We can make a big impact and avoid a polarizing Second Amendment debate.
Ted, I'll go to you.
Well, I agree with what Mike said, so I want what Mike said to be my closing statement. Because it's practical, and it's an approach that can have an effect and really change what's happening in the lives of people. So, Mike, I applaud you for what you're doing, for the Giffords Center's excellent work, and keep doing it.
Thank you.
I would say that we all have a responsibility to act and get involved. And as we do, we have to keep survivors and people who have been affected really at the center of this conversation.
I would say that there's so many things that non-government entities can do, like hospitals, like companies. I would say that within government, there's so many things government can do, which aren't just here's we're going to pass this particular law, but government is crucial for data systems. Government's crucial for funding research. Government's crucial in terms of it's a big buyer. The reason I think we have airbags in the United States is that the first institution to buy lots of airbags was the federal government. Without that, we would not have airbags, I don't think. And the one thing that I would like the government to do is to hold more hearings about firearms, and I'd like to see the Surgeon General stand up and say something which I think the evidence is overwhelming, that a gun in the home increases the risk of suicide. I think the evidence is stronger for that than it was when the Surgeon General half a century ago said cigarettes cause cancer. And I think people need to understand when they bring a gun into their home that both the benefits and the risks.
Well, that concludes today's panel. I'd like to thank the audience here for attending and our panelists for a tremendous conversation. Thank you.